Federal governments are elected for a maximum term of 3 years, and they can, and do, go earlier when it suits Prime Ministers, who can, within limits, time elections to go to the polls at the peak of their popularity, or avoid elections when they're on the nose. Some Liberal and Labor MPs are now thinking that Prime Minister Kevin Rudd is thinking of calling an election for August. Their reason for thinking this relates to the attempted takeover of state-run hospitals by the federal government. The chances of the Commonwealth and the states agreeing on the takeover when they meet in Canberra on Monday are getting smaller each day. It's an election issue, say the pundits, crafted by the Commonwealth, and it could be a winning issue. Last night and this morning, when I spoke with federal MPs from both Liberal and Labor, they were seeing this takeover in strictly political terms, not health terms. And that's one reason why throughout the health debate there's been little mention of how the changes would affect one of the most vulnerable groups in Australia, the mentally ill. Mental health is not a vote winner. Greg Barnes wrote in Crikey yesterday that the focus is on sexy, headline-grabbing and vote-changing issues of aged care, hospital beds, waiting times for surgery and access to physical health services, not on mental health, even though mental health and physical health are so closely intertwined. This is not just tragic, says Barnes, but scandalous. Mental health will still remain out of the reach of all except those who can afford it. More than 3 million Australians experience mental illness each year. 1 in 10 visits to the doctor is for mental health. The number of psychiatric beds has decreased by 80% over the past 40 years, while our population has doubled. Australia now has one of the lowest numbers of psychiatric beds per capita in the developed world. Health shouldn't be about politics or political grandstanding. It's time that changed.